social impact organizations, their leadership are reaching out to me on how to get consistent funding for their health programs, their health initiatives, even overall operations costs to ensure that they have the capacity to serve those programs and initiatives, right? How do you get consistent funding for those things? Consistent funding doesn't just come because you have a great program. It doesn't just come because you have a name behind your initiative. Yes, that helps, but that's not the sole reason why health organizations get consistent funding that goes beyond grants, right? I love grants. That is the foundation of my career. I've won and managed over 12 million in funding, not just in grants. We've helped our clients secure thousands to millions in grants. But I know that it doesn't just take you applying. I know that it doesn't just take you knowing someone. It doesn't just take you having the brick and mortar or not, because you don't have to have a brick and mortar to get consistent funding for your health programs or initiatives, right? There's so many other steps behind that should happen prior to that. So we have a 5-step community impact framework that helps organizations understand the things that should be in place when you're applying for funding, right? I think every day is a good day to reach out, ask, connect, apply for funding. But if you have leaks in the pipe that is causing funding opportunities to slip through, then we help you to fix those, right? I'm Brittany Jenkins. I'm the founder and CEO at Jenkins Public Health Consulting. We've been established since 2018, helping organizations all over the country, all over the US and US territories, build stronger programs, stronger partnerships, and attract people for those programs so that they can get consistent funding, right? If you don't have people in your programs, if you're not serving the people that you aimed to serve when you open that program or that organization, you will not get funding consistently. There's a lot of organizations, the leaders, the founders, the CEOs who I'm talking to, who are self-funding their health programs and initiatives when there are billions of dollars waiting for them, right? Get a piece of that that's available to them, right? So I love talking about that, what's necessary to get funding for your health program or initiative. So if you are the founder, CEO, a director, or even the staff of a health organization, that can be a hospital, a clinic, a health department, a pharmacy, a nonprofit organization, a food bank. It can even be a for-profit organization who is helping the community improve health. If that is you, this is an opportunity to talk about how can I get funding for my existing programs or services where we are right now, if that's been hard for you. If you don't have an existing program or service and you know that's something you want to create, let's talk. How can we make sure that while you're still in the creation phase of your program, service, or initiative, how can you still get funding for that? Because one of the common misconceptions is that, hey, my program doesn't exist yet, I can't get funding. There's plenty of research that shows why your program is needed. How do you put that in front of the funder, not just grants, to believe that you are going to meet that need with your existing program and services? So I've worked in government. I've worked for the local, state, and federal government for over 10 years. I'm still doing business with the government. I've been in healthcare and public health for over 15 years. And so as a director of a medical center, formerly the director of a medical center, I've seen millions of dollars moved around in programs and initiatives and what it takes to keep them funded. Okay. Again, organizations who have existing programs does not mean that they're going to get it consistently funded, because there are leaks in the pipeline that need to be plugged in order to get diverse and consistent funding. Hey y'all, let me make sure that I am engaging. Let's see. Thank you, Hulk. I appreciate that. Hey, I'm just getting on YouTube Live just to connect with people more about this, because we see a lot of things happening in the news. There's a lot of hopelessness. There's a lot of stress. There's a lot of fear. There's a lot of people dying. There's a lot of people who don't have access to the healthcare that they need. And I want to be that source of hope for people. not only am I trying to reduce my stress in everything I do, but I want to give hope to the founders, the CEOs, the staff, and the community that there are programs still available that are fully funded or have the capability of being fully funded, and that all hope is not lost. All hope is not lost. We match organizations to millions in funding without just loans. That wasn't even a loan. We match health organizations to 1.1 million in funding in just a few days, not even a loan, to help them reach more patients, serve more people, so that they can actually have peace of mind going home to spend time with their family, right? And so there's opportunity available despite what we're seeing on the news. That's not to disregard and to be blind to it, but fear tactics, okay, lead to fearful actions. And a lot of the times people aren't taking action because they are fearful, or because they are misguided, or they don't believe that it's possible, right? A lot of the things that I talk about on my webinar, we do a webinar around how organizations can get funding and what it really takes to get there. And I believe that people don't really believe that it's possible, okay? There's a percentage of people who believe it's possible, they take action, and then they get the result, okay? Actually, research shows that only about 3% of people take action to get the result that they are looking for. I mean, that number goes across so many different areas of work that I've done, and I know it's true, because people want to believe things. Like, it's hard for people to believe things if they haven't experienced it themselves. It's hard for people to believe something is possible because, or if it hasn't happened for them yet, right? So like, you have this dream house that you want, but you're like, man, I don't think that's ever going to be possible for me. You don't think it's possible because it hasn't happened for you yet. But what actions are you taking to make that happen? What actions are you overlooking that's necessary to make that happen, right? What does that look like, right? And so I could talk about a lot of different things because I also mentor men and women around the world to get in high-paying, high-quality jobs. And I'll be honest, that is more of the reach that we have on our YouTube channel and some of our content. But 90% of the work that I do is helping health-focused organizations strengthen their programs, strengthen their partnerships, and reach people that they aim to serve so that they can get funding for their programs, so their community can thrive and be healthier. So we don't have to pay so much in taxes, right? When our communities are healthier, we have a lower cost of living. When our communities are healthier, our health care costs lowers, our taxes are lower. We don't see that or believe that because, of course, it takes a lot more work, but it's possible, right? I personally help to reduce the burden of disease in Alabama. Alabama, it costs $40 million. I think it's like $44.4 million a year in lost productivity and medical costs. So much of that population is sick that is costing that much money a year due to lost productivity and medical costs. And so I was able to work with health organizations, pharmacies, nonprofit organizations to reduce hospital admission rates by having stronger health programs in place, by having stronger partnerships in place, and by making sure that their programs were fully funded so that they can do their job as health professionals, and while patients are getting access to these resources, to reduce unnecessary visits to the hospital. Okay, I personally just had to go to the ER in December. I'm okay. But when I saw how much it costs just for the emergency room bill, it was $2,200 before insurance. For someone who's consistently dealing with chronic illnesses or chronic diseases, going to the ED, that is debilitating. That is debilitating. That is hurting communities, that's hurting the hospital. Because, I mean, let's be honest, it's hard to even pay $2,200 back even after insurance, right? So at the gist of it all, I'm just wanting to talk about some of the key elements it takes for health organizations that have consistent funding for their programs and what I've been seeing. So I see a lot of successful health organizations. Most of the organizations that I support, they're not new startups. They've been around since longer than I've been alive. And we believe, and what we see from our needs assessment, because we have every client do a needs assessment. And they think that their name is going to help them get to fame. I just kind of put that in there to make it sound right. But they think their name is enough for people to understand what they do and why they do it, or to access it, right? Let me see you. Hello, hello. So, it takes more than your name of your organization to reach people you're aiming to serve, right? We help organizations go from engagement to recruitment for their programs, right? So you're going to a community health event. You see this nonprofit organization who's helping to reduce smoking rates in their community. A lot of the times they have not done the best practices to engage people there, to educate people there, to recruit people there. And then after the event, what is happening, right? There's a lot of the times that organizations are spending over 160 hours. And if you are here listening, you understand that's a lot of time, right? I think sometimes staff don't realize how much time that is and how much that costs organizations. Not that they're right or wrong doing that work, but if they're spending 160 hours per month on community outreach, and you're not seeing what's happening with that 160 hours a month, there's so much wasted financial opportunity, number one, and then opportunities to improve health outcomes. Because the goal is to meet them at the outreach event, the patient or the community you aim to serve, educate them, build trust with them, and then get them in the free or low cost health program that you have, right? And maybe it's not low cost, whatever the price is. The goal is to get them in this health program to improve their health. But a lot of the times, from the outreach and engagement to recruitment, there's a significant amount of loss because there's no standard procedure. There's no pathway to recruitment. There's no pathway from engagement to recruitment, which makes it hard for organizations to get funding for their initiatives, especially if they're spending hundreds of hours a month on outreach and they have nothing to show for it. Community outreach and engagement is such an important topic that I don't care how nerdy or dumb or generalized or basic that sounds. Without people in your programs cannot be fully funded. With your grants, let's say starting with grants, you have this grant that you won. Great job, you won the grant. But you still have to get people in these programs for the good, for the better of the people, right? The benefits outweigh the risk, right? So it's okay that your organization is doing things to get people in these programs, but the ethical way, obviously, and without doing so or overlooking effective outreach and engagement, that hurts your finances more than organizations realize it. We showed this organization that they're wasting, I think, $28,000 per staff member, okay? $28,000 per staff member because of the ineffective outreach that they've been doing for the last 5 years, okay? They have 5 staff members. They've been doing outreach the exact same way before they met me and before they learned our framework. And we helped them realize that they're wasting $28,000 per staff member. What could I do with $28,000? What? I could do a lot of things, right? They could do a lot of things. A lot of things could happen for that community. A lot of things could happen for the reach of the programs and services that the organization is doing or has, right? And it doesn't matter if you're a nonprofit. It does not matter if you're a for-profit organization. Those both are businesses. A nonprofit is a business. I came from working in nonprofit to working in the for-profit sector, and I've learned so much about the thought process of nonprofit leaders, right? And how that impacts the effectiveness, the sustainability, the opportunities, and community health outcomes because of what we don't understand about business just because we work for an organization. I don't have a degree in business, but I am a business owner. I also have other investments, okay? But I know that a lot of the times, nonprofit leaders aren't operating as businesses. even if they provide free services. This is not about free or paid services. This is about operating the organization in a way that's going to keep it open for our community, right? Who are we partnering with to make sure that we as an organization aren't doing everything on our own to keep the doors open, to reach those people we aim to serve? That's why partnerships are so, so important. Overlooked. Oh, well, I already know everybody, but if you know everybody, why are your programs still suffering? Why do you have low retention rates? Why are your program outcomes not where they should be? If we have partners, we need to utilize our partners in their areas of strength, right? We can go deeper into that. But effective programs, effective partnerships lead to consistent funding. A lot of the things that I see missing from effective programs also include not having assessments and surveys throughout the program period to ensure that you're reaching or you're hitting what you promised, right? You're helping them meet their goals, or you're identifying weaknesses in the program. People say, oh, well, we did all of that up front when we first met them, and all of the things that you've given to this person is a binder of information that they're never going to look through. And there's just a lot of miscommunication pieces that cause people to have doubts, or to not buy into the program, or to not take action, or to not be compliant. Okay, so effective communication, ensuring the people you aim to serve have the resources that they need throughout the program, and also having surveys built in pre, mid, post, so that you can understand where your patient or where that community that you're serving, where they are, and how you can make it more effective for them before the program ends. A lot of times we only see, if they do have a survey, they only have it at the end of the program. Well, you didn't collect baseline information to understand them. You didn't collect baseline literacy or health literacy information to understand where they are in their health journey. Taking someone's, their vitals, that is not the same. Knowing my A1C level, knowing my weight, knowing my birthday, that is not the same as understanding, do they understand what A1C is, how to track it, right? And it doesn't even have to be so medical, right? It can be, do you understand, carbohydrates versus whatever. At the end of the day, organizations who have health programs and initiatives, they don't have surveys in place to identify what can make their program more strong and to understand their patients better. This is why they have low participation, low retention rates, and low funding. Because without people, there's no funding in your programs. Without people, it can seem like your programs are ineffective. But when you actually plug those holes, right? Provide the appropriate surveys at the right time, make sure you have a plan from engagement to recruitment. What is your retention and your engagement plan to keep them in the programs, right? How are you going to highlight or amplify the impact that you've made or that these patients experienced from your program or initiative, even if it's a one-day initiative? And a lot of the times there's missing elements from that. And the way that I'm talking about it now, it can seem like so much more to do, but you're already doing it. And actually, when you put things in place one time, that's all you need to do is one time. There may be some adjustments that need to be made after looking at the outcomes or after seeing, your retention rates increase or decrease. There's still some things you can play with, but at the end of the day, standard procedures help organizations grow. Standard procedures help organizations grow. And it's crazy because these words are, a lot of organizations and leadership kind of look past them like, oh, we got a standard procedure, but nobody looks at it. No, that's not allowed. That is not allowed, because without a standard procedure, people are just doing whatever they want to do. Well, they're doing the task, but they're doing it however they want to do the task. The standard procedure for community outreach and engagement saves the organization time and money. It improves communication among teams. It ensures you're actually recruiting patients. You're not just talking to them. right? I could say hi and bye to you, and that's just the end of it. But if I actually have an engagement to recruitment plan for those I'm aiming to reach, you're gonna see your outcomes improve naturally. And even if you're a one-person band, right? I have helped organizations who are solopreneurs, who own a pediatric, programming or health education classes, right? Create standard procedures for that, so that once you build up your momentum and you're able to hire, you can just hand that task over. Let me see. I'm just looking. I need to get my glasses. I don't know where they are. But yeah, just on here chatting. Thought I'd get on here while I'm fixing some of our ads on Facebook and Instagram, and thought I'd talk about why I'm seeing organizations who are legally established. They have the number of staff, they have the capacity. But with capacity building, it's more than funding. Applying to more grants because you're underfunded or need more funding is not always the solution. And most of the time it's not the solution at all, because there's other broken pieces that's causing you to get declined or looked past, because you're submitting your application with the same mistakes, right? So for example, a medical center, world-renowned medical center, okay? You think that they just finally have it all together. Well, not even finally, because different departments, different people, different skill. But at the end of the day, you would have thought their name was enough for them to get funding or stay funded. Well, they've had the same partners for 40 plus years, just the same two people or two organizations for this 40 years. And you would think that, how could that be possible, right? They're out here networking, they know such and such, but partnerships means collaboration. It's not just who you know. How are they collaborating with you? How are they helping to expand your reach? How are they telling such and such, hey, this medical center needs funding? Do you know someone? Like, partnerships is more than knowing someone's name and having a conversation, right? And so when your organization is doing the same old thing with the same old partners for the same old years, submit the same application, you will lose funding. They actually lost, I think, about $40,000 in funding. In 30 days, they were notified. They were notified that they were losing $40,000 in 30 days, and they had no plan to recover. They had no plan to recover. A lot of organizations I talk to lose $7 million in funding. Literally, this is real life. That sounds very sad and hopeless and scary, and communities are going to be, hurt from that. But the issue is we're not preparing ahead for that. When we're only dependent on grants, when we only have one or two partners, funding will be limited. And just like everything else, organizations who get funding, sometimes priorities do change and they no longer get that funding. But a lot of the times, if they're showing the impact that they're making from the people that they're serving, from the partners that they're collaborating with consistently, it's not about having a whole bunch of partners. We have a whole different training on capacity building and partnerships and what that looks like and how you can make it a good utilization of your time as an organization and how we can help grow your reach, right? That's a whole conversation and a whole training that we do. But yeah, partnerships are such an easy and great way to leverage. And with partnerships, it brings in a lot of different types of opportunities for you to support the capacity needs, right, of your organization. Let's see here. I need to check these comments more. Oh, it's just people saying hi. Hello, hello. But yeah, I'm just on here chatting. I wanted to actually go through this business health check. So our company, Jenkins Public Health Consulting, I'm the founder and CEO. When we take on new clients who are trying to scale their organization, their health organization, whether it's a nonprofit or a for-profit, we like to have them go through this business health check index. And with that, it looks at opportunities for them to fix so that they can bring in more revenue or funding opportunities from diverse sources, or maybe get more participation or patients in their programs, right? And so I just wanted to touch on a few things. A lot of organizations want to do business with the government, and they think just because they have their LLC, their S Corp, their C Corp, etc., that they can just do business with the government. That's not always the case. And so, being registered with sam.gov is so important, even if you're not looking for opportunities on sam.gov. If you know anything about sam.gov, it is a pretty complex platform. It's completely free. If you have a nonprofit or a for-profit organization, it does not matter what you do, you should be registered on sam.gov for sure, because that is pretty much a platform for all types of business, not just health-focused businesses. But sam.gov, being registered on that platform itself opens up so many more opportunities that actually aren't even listed on that platform. I'll give you an example. Doing business with the U.S. Virgin Islands, right? My business is LLC'd in multiple states, so we can do government contracts in multiple states. But we qualify for federal level work because we are with sam.gov. We are registered through sam.gov, right? So that allows any U.S. state or U.S. territory at the federal level to say, hey, we want to do business with Jenkins Public Health Consulting. And since I'm already registered, since I planned ahead, got all my paperwork in order, I don't have to wait or delay or miss out on that opportunity because I'm already registered with sam.gov. sam.gov, again, opens up opportunities that may not even be posted on sam.gov because it's all about the registration status. It means that it kind of further qualifies that you're a legit business doing business in a specific location. You don't have to have a brick and mortar. You don't have to have you don't have to have any staff. You can be a solopreneur. You can work from home, because having a legit business also means that you can work from home. Your business can be located in your home, okay? So get a sam.gov account. Just do it. If you're not planning to be in business in the next couple months, like maybe not. But at the end of the day, you should have that account so that it opens up opportunities for you and your business. And this is for nonprofit and for-profit. The business license, there's been clients who've come into some issue with the business license, especially if they're doing in-person business locally. And this is not legal advice. This is just me giving you what I see as needs in business. Your state might be different and all of that, but for the most part, you do need business licenses, which is separate from your business being legally established. You need a business license to do business in person in your county. Okay, so organizations are missing out on that, which can prevent them from getting contract opportunities at the county and state level. Okay, so the business license is a big one too. Since I do business virtually, and 90% of our clients, we don't have to have a business license. Sometimes we've seen contracts that required it. It's really not hard to get our business license in the states that we're certified in, Indiana, Alabama. But for the most part, most of the work that we do, you don't need a business license. That's not the same as being a registered business. It's different. So some of those things we're seeing as organizations are established, but they are impacting the opportunity to serve people or to get funding because they don't have these things in place. Okay. Contracts are huge. We see people who are signing agreements, but it's not the same thing as a full-on contract that protects you as a business owner, that makes it clear on what you're doing, why you're doing it, what's the price, when's this happening, what happens if the client changes, what happens if the number of patients actually, aren't attending this program, but you were hired to do this program. What happens, right? The contract. And people are using AI to generate contracts, which is the biggest mistake that people are making. One of the things in business that you should not skip out on or cheap out on is a business attorney. There are a lot of free programs for business owners to have a free business attorney. I had a free attorney for the first 5 years in business, and it didn't save my business, but it elevated my business, because now these organizations who are multi-million-dollar organizations, they ask for my contract. I send them my contract. I prefer to send them my contract because we own the intellectual property of what we're teaching, right? We have this 5-step community impact framework that has literally helped organizations bring in more patients, have more quality partners that show up, engage, and actually financially support the initiatives. We've helped organizations get consistent funding for multiple programs that they've built. We've helped organizations secure 5-figure contracts in just a few months, serving over 40 patients in healthcare systems. That's our framework. So when we have our contract in place and we know that utilizing our intellectual property, or we're protecting our intellectual property with our contract, because a lot of the times contracts can be hard to negotiate when you're doing business with the government. So we prefer to send our contract because we already know what's in it. It's been written by a real attorney, and it aligns with the services that we're providing, and it thinks long-term, not just in the short term. Okay, so some of this stuff is indefinitely. That's in our contract. Indefinitely, you can never use our framework without our permission. You cannot reprint or revise our framework without permission. It's helpful in business if anything has to be addressed in the future. The interesting thing about a business plan, I don't really like business plans. I really don't. It really depends on what you're trying to do in business. I think as a, first-time business owner just getting started, yes, you need to have a business plan with the forecast and understanding who your client is and everything. We're way past that now in our business. But the business plan, some people take way too much time trying to put that together when they already have a viable business idea and they just have to take action. Okay? So sometimes it's just about ripping that Band-Aid off and taking action. How can someone get in touch with me? You can, I think you would have to leave the live, but I'll tell you our website, Jenkins, 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 PHC.com, JenkinsPHC.com. I'm the founder and the CEO of the company. And so basically we help organizations strengthen their programs, identify quality and engage partners so they can bring in revenue and funding consistently and keep their doors open. It's so important. Really just seeing the stress of people all around me, not even around me, but because I work with organizations and leadership all over the country, all over the world. So when they're coming to me in stress, I'm like, stay hopeful. Like literally there's so much opportunity. And I know when you're fighting through it on the day to day, it can seem impossible. But just know that if you identify a need that your organization has, don't look past it. Don't just go to YouTube. YouTube is tactics. YouTube is full of tactics, right? It is not custom to your health organization, your needs. Even if I'm working with 2 pharmacies, which I do work with pharmacies as well, right? We help a pharmacy scale from a couple $100,000 a year to multi-millions. Okay, because I help them design health programs. I help them recruit the proper staff. I help them reach the proper patients. And I help to make sure that the impact was being tracked and promoted to the right people to get consistent funding. Okay, yeah, I forgot what I was saying. I get so excited about this stuff. And I feel like I'm always nerding out. It's funny because like my husband, he reads like thousands of books and I read thousands of research papers. Okay, so I'm not really a book reader. I'm a research paper reader. But it's just really interesting because I will nerd out on that for real. So let's see, any questions? If you're here, drop any questions. Drop any questions that you have. The interesting thing too, a lot of organizations are building programs that are not even accessible, right? It's not even about the price. It can be completely free, but people can't access it. And this isn't just about online courses, because sometimes online courses are a lot more accessible than the programs that are in person. And the issue is that they're not partnering with the right organization. So there was an organization in Alabama, and they had a chronic disease prevention program for patients. The common issue that was coming up was that people couldn't get access to the program, right? They didn't have the transportation. And instead of the organization saying, oh, okay, like this is a common issue coming up, let's address it, they're just saying, hey, sorry, we don't provide transportation. So that's another thing. Sorry, there's another thing there that's affecting the outcomes of your program or initiative when you're overlooking or you're ignoring or you haven't trained your staff to listen and address the issues at hand, right? So partnering with the transit, like you can partner with the city transit. Did you know that? You can partner with the city transit to get bus passes, right? To ensure that people who are trying to get to your program have bus passes. You can partner with Uber. You can partner with these organizations. People don't realize you can partner with them, but you can. You can partner with the bank. You can partner with any organization. They don't have to be exactly like yours. They just have to believe in your mission. They don't have to have the same mission. They just have to believe in your mission. And for them to usually make a monetary transaction, they want to see that you're actually making an impact. What has your organization done? Or what is your organization planning to do? How does research confirm that this is a real need? Or how has your past impact shown that you're actually making a difference? And without people in your programs, without partnership at the table, and without tracking the right performance measures, that's even a different conversation. They won't understand why they should invest in it, even though it is so, and it's very needed and highly impactful. Like it actually works, right? So anyways, one more thing I'll address, because I'm looking at the time, I have to get going soon. What is the question I had? Marketing, right? So I'm just touching on a few things as part of our framework. Our framework is 5 steps, right? 5-step community impact framework. Equipping staff and stakeholders, number 1. No one likes to go through the first phase. Like nobody wants to go through equipping staff and stakeholders because it seems very repetitive. But 100% of our clients who go through the first step of our framework, who fight against it, they have identified skills that they needed to grow. 100% of our clients. And I'm not a doctor. I'm a certified health education specialist. I have a bachelor's degree in public health. I've been in business for 8-9 years now, and then also been working in healthcare and public health for over 15 years, right? I've been a director at a medical center. I've overseen 7 chronic disease programs at the government level. I have that experience, but it does not matter where you are when it comes to like your credentials. There is always things to know so that you can operate your programs, your organization, your teams better. Okay, so with equipping staff and stakeholders, we help them understand the people they aim to serve at a deeper level, beyond demographics, beyond gender, race, location, right? Because that's typically what's required for a grant, having that information. We help you understand the psychographics, the psychology behind the person you're aiming to serve. What are they fearful of? What do they need most right now? Where do they spend their time? Where do they get their information from, right? What are their goals? When you understand that at a deeper level, your program will be more effective, period. The reach, the delivery, the outcomes, and the funding opportunities, okay? But again, people take this information, they don't take action, okay? So it's really about, what does your organization need? Where do you see you falling short? If you don't see you falling short, but you're not where you want your organization to be, that means you need to have an assessment done to identify the leaks, and I can help you plug them, okay? So again, I'm Brittany Jenkins, founder and CEO of Jenkins Public Health Consulting. I help organizations design effective programs, get people in those programs, identify effective and engaged partnerships that alleviate the capacity needs to not solely be on the organization, to not solely be on the staff, right? And then we help you also identify funding opportunities beyond just grants and loans to sustain you long term, not just for that year, not just for that season, because that's the issue. We see grants, and there's a lot of reasons behind grants. The grants aren't bad, but they can be very temporary. They can be very seasonal, right? You have a grant for a year, no matter how much it is. Let's say it covers the cost of your program. What's going to happen next year? Are you doing the work ahead of time to plan for a year out, that when your program is successful and completed, what happens next? How are you funding them a year after year? Because the goal when you are funded a grant, the goal is to get you up and started, reaching people, but sustainability is your responsibility. Sustainability in the people. Maybe you might need to change a pricing structure beyond grants and look at partnerships or people to pay out of pocket, etc. But it's important to look at those things. Okay, so let me talk about the 5-step framework real quick, or list it out. Step 1 is equipping staff and stakeholders. Step 2 is tracking performance measures, key performance indicators to identify what's working, what's not working, the outcomes of people who are in your programs. There's a lot of different performance measures your organization can choose from. That does not mean you should be doing them all. And if you're tracking performance measures that the grant funder itself set to track, if that's the only thing you're tracking, you're missing out on a significant amount of impact that your organization could be promoting. Okay, it doesn't mean to track 100 more things or whatever. What are you tracking? Why are you tracking them? How does it highlight impact? What are these numbers really telling us, right? If you're tracking the number of likes that you got on a post, I'm sorry, that isn't the most effective performance measure to be tracking for effectiveness of a piece of content. There's other levels of effectiveness of content on social media that organizations should be tracking, right? It's more than likes, it's more than shares, it's more than comments. Are people truly going from viewer to doer, from engagement to recruitment, from engagement to a phone call, from engagement to a meeting with you, etc.? That's performance measures that are actually effective, okay? The 3rd step of the framework is capacity building. Okay, so building capacity is more than funding. It includes people at all levels. Our community champions, our other organizations who are partners, our internal staff, our board members, our volunteers, okay? You as the CEO and leader of the organization, that is capacity building. And obviously it also, it also includes various funding opportunities, okay? Beyond loans, beyond grants. There are so many different loan companies that are beyond traditional loans. There are also so many different grants that are beyond traditional grants that have restrictions on how to use the money. So that's the 3rd step, is build capacity. The 4th step is marketing effectively. Health literate marketing, marketing that is social marketing is different than social media marketing. Social marketing is making sure you understand what you're putting out, who is reaching, and the action people are taking behind what you're promoting, okay? So marketing effectively is health literacy, digital access, or even offline marketing as well. And then the 5th step is community impact, right? How do we effectively conduct community impact in a way that is transformative for those we are serving? And it's reaching those we aim to serve beyond just that outreach that we're doing, right? So during community outreach and engagement events, what are you doing beyond that to engage with those you aim to serve? Okay, so just wanted to put that out there real quick. That's our 5-step community impact framework. We help organizations grow the number of people they're serving, the number of partnerships that they have, and the revenue that they need to thrive, not just survive. Have a good day.